Every year, thousands of future doctors begin one of the most defining journeys of their lives, the residency interview season. It's exciting, challenging, and sometimes overwhelming. But what if I told you that you could manage this process with calm, clarity, and confidence? Welcome to our first session on residency interview management. I'm Dr. Sarah Ahmed, a hospitalist and educator, and I will be your guide through this bridge from student to resident. When we talk about managing something, we mean taking control of it, not letting it control us. It's the ability to plan, organize, and execute intentionally. Management in any setting, whether clinical or personal, is really a mix of clarity, structure, action, and adaptation. You don't just go with the flow, you orchestrate the process. The word management here is used intentionally. It's widely used in other fields like business, for example. You have project management. It's a process by which you actually take control of your project, upcoming project. The project would be anything. Any process that has steps, has multiple tasks, it has multiple maybe people or multiple participants. And you would like, as the manager of this project, to be able to control these processes and organize them in a way that you achieve your goal, objectives, and deliverables in a manner that is the most efficient. So basically, you are improving the performance of your team while achieving your goals. That's exactly what we mean when we use the word management here. The residency interview is a process, and it can be dealt with as a project. Okay? And to be honest, it's one of the most defining projects of your life. And this project, you can think of it along two domains. The process itself, with its timeline, with its logistics, with its all the communications and all the inanimate things that are involved. And the other part is you. You are the other domain. You are part of the project. You are the one who is going to perform. We need to manage you and your performance as part of this process. Okay? So preparing for this residency interview, you are dealing with the part that is outside you, which is the logistics and the other management requirements, and yourself in terms of getting your stories in order and aligned with whatever program you are being interviewed in, and improving your performance, knowing your goals, knowing your vision for the future, improving your skills in terms of communication, managing your anxiety, being in control of your emotions. This is you. All this is about you. So this project, which is the residency interview process, is your project. You are the project manager. you need to be managed as part of the management process, besides managing all the other affairs surrounding this process. That's what I meant by using this term, management. Think of the residency interview process as a bridge connecting where you are today to where you want to be, meaning which residency program. You want to be in a residency program. Okay, this is the next goal in your life. This bridge stands on 5 strong pillars. Each pillar supports your ability to cross smoothly and confidently. Let's look at these pillars. Okay? As I said, we are dealing with a project, and this project requires organization, requires planning, requires clarity, requires efficiency, and so on. Okay. So the pillars on which our bridge actually rests, the stronger these pillars, the more smooth and safe our crossing to the other side, which we are all hoping to do during this time. Okay? The first pillar is strategic planning and logistics. Okay? This is the first pillar. Laying the tracks before before you start your journey. Here, you organize your time, create your calendar, track your programs, and plan travel or virtual setups. Think of it as a backbone of the process. When logistics are clear, your mind is free to focus on performance. These are things that need to be done. If you are one of the lucky people who has more than one interview, you really need to organize this. You need to know the timing, place them in a calendar, research each program, know what to say and how to approach your answers with that program, depending on their culture, depending on the information that you got about them, their unique features, and so on. So you need to prepare for each program. But before you start this preparation process, you need to line up your timeline. Okay, when is each of these interviews is happening? This is very important. So the first pillar is about organization, the planning, the structuring, the scheduling. All this is organization. This is the magical term here. Okay, and it's essential to take this anxiety out, this stress of being in a chaotic situation. Okay. The next pillar is preparation. What do we mean by that? As I told you, you are part of the domains that needs to be managed. So you need to prepare yourself. You need to prepare yourself for the best performance that you can achieve. And this preparation process has multiple branches to it. You need to know the program. As I said, researching the program and knowing their culture, knowing their unique feature, knowing their performance overall, and knowing what to ask the interview panel or the faculty. the program faculty. You need to prepare questions to ask them. This will make you appear smart, appear engaged, and genuinely interested. The other part that you need to prepare for is your story. I usually tell people during the interview process, they want to know you as a person. And there is a saying in philosophy that previous behavior usually predicts future behavior. So the way you addressed your life experiences in the past, the way you dealt with them, can safely predict how you're going to deal with future events and future challenges. I'm not sure it's a philosophical thing. It's a psychological thing, at least. So the stories and the experiences you had in the past, when you tell them in response to the different questioning, when we call them behavioral questions, it tells them something about you. So you need to be prepared to tackle this part, to tackle these questions. This is part of the preparation. This is preparing yourself. Okay? And part of this preparation process is to know yourself, know your strength, know your weaknesses, and the challenges that affect you or you go through and you went through. And I usually tell my students that there are certain traits that these interviewers are looking for. If you can show that you have these traits, if you can show through the storytelling process that you actually possess what they need, you are the best fit for their program, then you succeeded and you are you did your best performance. Okay? So this preparation process is about clarity. Clarity in knowing the program, clarity in knowing and evaluating yourself, and clarity in leveraging your strength. The third pillar, which I think is maybe the most important, is communication and presentation. Okay? Your actual performance on the bridge, the actual walk. We said management is all about efficiency. And interviewing is basically communication. They talk to you and you respond to them. And this response is the message that you are sending to your listeners who are the interviewer. Okay? And this message needs to be clear, needs to be focused, precise, needs to reflect who you are. If you manage to do all this, then your communication was successful. You actually achieved what needs to be achieved during an interview process. Interview is all about communication. The better communicator you are, the better received your stories and your responses are. Okay? But there are criteria. People usually come up with all sorts of stories about their past and how they dealt with it. And usually people try to show themselves as the best people and the perfect people. They are not looking for perfection. When they ask you these questions about, tell me about a challenging time in the past or a challenging event and how you dealt with it and what you learned from it, they are not looking for perfection. They are looking for certain traits in your personality that will tell them that you are a good fit for us. You have the mental toughness to deal with different life events. You are resilient. You are able to overcome adversities without being broken or without breaking. Okay, so it tells you something about, or it tells them something about you, and that's the goal. Actually, that's what you want to do through your communication. But I need to warn you, stay away from being fake. Usually, people, when they tell us a story about a genuine story, an authentic story about themselves, it comes out off as believable, as possibly reflecting your values and reflecting your abilities. But if you invented something, then it will show. It will show because it will be empty. It will be really unauthentic. Authenticity and honesty are very important traits that people look for. And this is what creates the connection. Okay? Through your communication and through the presentation of your stories and of your life events, you are looking for a connection. And if you succeeded to generate that connection, then your interview was successful. Okay, regardless of the outcome. The outcome has many factors controlling it, but you succeeded if you created a connection with the person in front of you. Okay, and this connection needs to be meaningful, needs to leave an impression. You need to be memorable. Okay, don't be forgettable. The minute you leave the room, nobody knows anything or remembers anything about you. Okay, so authenticity matters more than perfection. You are not auditioning, you are connecting. It's not an audition. Huh? When you speak as a future colleague rather than a nervous candidate, people remember your warmth and sincerity. Okay, now we go to the fourth pillar, which is emotional and mental management. It's one many forget. Emotional and mental management. By the way, your performance, which we are trying to make or improve or make more efficient, is greatly affected by your mental state and emotional state. And if you fail to address this matter, no matter how much preparation you made or you do, is going to be ruined. An anxious, stressful person has the worst performance when it comes to presenting themselves. Okay, if you are very anxious and very stressed, then you will definitely perform poorly. Okay, so what they are testing, remember, it's not a knowledge evaluation. It's not. They are not evaluating your knowledge. They are not checking facts. And they are not going to check after you in terms of what stories you told them and what events you mentioned. It's not about that. It's about trying to show yourself in the best possible way. Okay? You are trying to show that you are a good fit to their program. And let me tell you, a nervous wreck is not a good fit anywhere in healthcare. Okay? Mental toughness and emotional control are one of the best features in somebody who is entering healthcare. Okay? Because a lot of times you are faced with these very overwhelming situations in terms of emotions and in terms of succession of events and severity of the situations in front of you, and you need to have a level head to deal with them. Okay, so this is one of the things that tells them a lot about you if you are very nervous and very if you are an emotional wreck, basically. So this balance or balancing and controlling your emotions is a very important feature. Okay. And when people are faced with adversities, no matter what kind of adversity they face, and they come out of it stronger, and they learned a lesson or two along the way, they show resilience. And resilience is actually an indicator of mental toughness. Okay? Resilience is a product of mental toughness and humility and a growth mindset, because you are open to learn from your mistakes and from the adversities that you face. So resilience is indicated by showing this emotional control, okay, and the mental stability. Please work on that. Even if you are by nature a nervous, you have this nervous personality, or they call it neurogenic personality, then try to work on it. Try to work on some techniques and tactics that allow you to control yourself and present yourself in the best possible way. Okay. So now we come to the pillar number 5, and this one is very important. I called it reflection and adaptation. Whenever you go through an experience, any form of experiences, okay, you have to come back out of it after it's done and reflect on what happened. Okay? And here, what I want you to reflect on is your experience during the interview. And here I'm talking to people who has multiple interviews. Okay? You come back, you sit, and you try to identify the good things or the things that went well and the things that not so much. Okay? And try to adjust for next time. So you identify the good things and the not so good things, and try to adjust these things that didn't go up to your standard, and work on them and improve them. And next time, implement new plans, new methods, new ways. That's how you learn, by the way. Anything in life, it's not just healthcare, it's not just the interviews, it's life in general. When you do something, any kind of venture, any kind of experience, any kind of learning opportunity, you come out of it, you sit down, you reflect on what happened, okay, and you identify the weak points, the strong points, what went well and what didn't, and then learn from it, adjust it, work on it. And working on specific things, we call it deliberate practice. And deliberate practice is the way to be an expert in anything. One of the ways to acquire expertise is to do deliberate practice. And in deliberate practice, what we do is identify a weakness in doing anything. Okay, if you are learning guitar, for example, and you have one tune that you can't really work on, but otherwise the rest of the performance is good, deliberate practice is to focus on that weakness and perfect it. And that this way, your overall performance will be excellent. So that's what you do when you come to the pillar number 5, which is reflect and adaptation. And this reflects growth, a growth mindset, a growth potential. This is one of the best things for anybody who is trying to enter or be part of a learning process. Okay, if you are planning to be part of a learning process like residency is basically for learning, and you do possess these growth mindset and this growth potential, you are gold. You are one of the most desirable characters that they look for. Okay? So these are the 5 pillars, and the keywords are organization, clarity, connection, resilience, and growth. Okay? So just to summarize, your residency interview management rests on 5 pillars. These are the 5 pillars. Together, they turn an unpredictable process into a structured, empowering experience. Okay? So this is how you need to think about this process. Notice I didn't go into details. This I can do in the upcoming videos. Okay? But this time, I just wanted to give you an overview of how to look at this process. Treat it as a project that needs to be managed. And this management process can be approached through these 5 pillars. Okay? And it can be approached along 2 domains. You as one of the 2 domains, and the other domain is everything else. Your research, your logistics, your time, your energy, your resources, whatever you need to address and organize and structure. Okay? And always remember, managing this process isn't about controlling every outcome. It's not about the outcome. It's about directing your effort where it matters most. Getting the best out of yourself. That is managing this process. When you manage the process, you master yourself. Okay. So as I said, this is the first video in a series of videos about this process. And in our next episode, we will begin strengthening the first pillar, planning and logistics. Okay, and I will show you how to create your personal interview tracker and preparation calendar. If this session helped you see the big picture more clearly, don't forget to subscribe, like, and share this video with your fellow applicants. Okay, I'm Dr. Sarah Ahmed, and I will see you in the next video, where we start laying the tracks for your residency success.